Thank you, everyone. Those were great presentations, and I think you presented a really salient example of how a systems approach can be applied in a community setting to address, obviously, a very complex problem. And also, your transitions were flawless between or among the three of you. As you guys started out earlier, you all talked about how obesity issues are really complex systems problems, and they involve many players and moving parts. And we know when we're talking especially about things like city governments and policies and programs, these parts and players can be very dynamic. They can change. And I wonder if you might comment on how these dynamic parts influence modeling and what kind of challenges it presents. So I'll throw it out to all three of you.
So I can start off, and certainly Sara and Joel, feel free to chime in. So one of the reasons why we wanted to develop very explicit models to represent all the processes and components and mechanisms of the system, because we know that things may change. We know that policies and priorities may change, et cetera. So it's helpful to actually represent what's happening on the ground in terms of the actual mechanisms and processes. And then if things change, or if priorities change, or policies and interventions change, then you can adjust what's actually happening to the mechanisms. The flip side is you build a model that is really tailored specifically to a current situation. That can be helpful for that situation. But Sara, as you mentioned, if things do change, or the players change, or they might even say, well, I'm interested in different outcomes or measures, I'm not interested in those metrics, then you have to go back to the model and put those in. Whereas if you have a systems model, and that's the difference between like a systems model or like a statistical model or something which is more overarching and more broad-based, a systems model is actually representing these things. So you don't have to change it as much. Joel and Sara, do you have anything to add about that?
So I would add as an example of that iteration, the Staple Foods Ordinance experience, where, I would say that part of the reason that you see 4 different simulations run was because we iteratively went through different expectations, policy needs, and so forth. And so, we started off with the idea of a straight up staple foods ordinance, but then some of the things that I think we learned that the Minneapolis staple foods ordinance was actually unsuccessful in many respects. And for that reason, and for many other reasons, we moved to considering a completely different type of staple foods ordinance that would be more about increasing the number of stores that provide WIC or accept WIC or serve as WIC vendors in the city of Baltimore. And so, there was definitely an evolution of the systems dynamic model on the basis of changing needs and priorities within from our colleagues in the city government.
And I'll just speak briefly from the policy side. As was alluded to, there have been changes in leadership here in Baltimore over the past few years. So some of our leaders that were interested in promoting the Staple Foods Ordinance no longer are in office, and others had different priorities to where we have to kind of consider all these policy decisions in terms of who can move them and make them happen. And at the same time, Joel showed that the model for the SNAP depth of stock, which kind of, had a negative, would have cost retailers hundreds of dollars per month to enforce. And that was a federal policy decision that we were able to provide kind of feedback on and testimony to, but ultimately that kind of just evaporated over a change of federal administrations. And so I think that we have to be cognizant of all of the other factors at play that are necessary to move a policy, and that even if these models showed the best and highest outcome we would have to convince a lot of other people that they're worth implementing and enforcing, and that there would be the kind of person power to do that as well. And so that's kind of our job on this side, is to take this information and build the political will, as well as kind of navigate those federal, state, and local intricacies.
Okay, thank you. We have a lot of questions from our audience because this is such a riveting example. So we're going to open it up now to the audience. And if you have a question, please type them into the chat box and include the speaker's name if it's directed at someone in particular. We might not be able to get to all of our questions today because we do have a packed schedule. So our first question is for Bruce. If you think about the fact that SB consumption has been declining over the years, while obesity prevalence has risen, how can we validate modeling that tells us an SSB tax will have a net effect on reducing obesity prevalence?
Yeah, great question. So, of course, the question emphasizes an important point, that it's not a single factor that is driving obesity rates, and there's many other factors involved. So when we validate our model and validated different aspects of our model, it's really important to validate the model at different levels. So we want to. So let me give you some examples. We essentially instill all these behaviors into these individual agents, and then we have them moving around and making decisions. And so it's basically the decisions that are driving where they go and where they move around. And then one of the things we want to do is say, okay, let's try to validate the agent movement. Are they actually moving like individuals move? So we can compare it with on the ground data and say, okay, where are kids actually shopping to get their beverages or their food, et cetera? And does it match that behavior? Are there consumption patterns of other types of food? Do those match what we actually see in the real historical data? So we're validating at multiple levels, like what are the behaviors, what are activities, what are different consumptions. We also say, okay, are we mirroring historical obesity prevalence changes, and how closely are we doing that? So the first thing is you essentially try to make sure the model is representing what it's supposed to represent in all different levels. And one of the pitfalls that sometimes occurs is people will validate that against just one measure. Does it predict this? That's not enough. You don't want to just say, okay, does the model predict something? Because that can be an accident. You can accidentally, or you can actually overfit the model. You can make sure the model actually fits that one measure. So you really have to validate in multiple different ways to give yourself confidence that you're actually representing all the things that you want to represent. Once that occurs, you get to the level of confidence, then you can feel a little more confident that when you then introduce a new policy, it's actually going to be taking into account, all the different factors, components, and what you see may actually happen in real life. And I also want to emphasize that validation is not something that should stop. Like, you can never 100% validate a model. You continue to generate more and more evidence that you feel confident that it is representing what it's supposed to represent. So it's a continuing process, and you have to be transparent about the validation. You have to say, okay, this is what we feel is in place. These are some of the assumptions that we feel we are making, et cetera. So hopefully that answers the question.
Thank you. Now here we have a question for everyone, but prior to that was a compliment on your great presentations from the person who asked the question. For communities who want to be involved in modeling, is there a coherent strategy in order to get a coherent strategy for obesity prevention? What is a pathway process? How do you go about this? Is there funding? So I'll open that up to all three of you.
So I probably the three of us can address this. I think, Joel, maybe you can mention something about engagement with the community. I think that's really important. So, if you have a community that you want to build a model with. You want to bring them along in terms of the process. And really, this is a way of bringing different folks together. So, Joel, maybe do you want to mention some of the groundwork that you did in terms of building relationships within the community?
Yeah, so the work on these models goes back maybe 5 or 6 years, maybe 7 years. But the work that our team has been doing in the Baltimore community to try to improve the food environment goes back at least 15, 16, 17 years. So part of the secret is establishing relationships with people in the community and maintaining those relationships over a fairly extended period of time, and sort of demonstrating commitment and so forth. The other thing that I think helped us with being able to start doing some of this modeling was we had done other kinds of interventional work in corner stores, in carry-out restaurants. And this supplied a lot of the data, including needed for parameterization, and certainly the perspective that enabled us as researchers to contribute to the model building activity. But a lot of it's relationship building and partnership and the need. The other thing, part of the question relates to funding. In addition to this U54 to sort of support simulation or system science modeling work, we received some funding from the CDC through their NoPrin collaborative network. NoPrin stands for Nutrition, Obesity, Prevention, Research Evaluation Network, to support this. And so there was certainly interest at the CDC level as well as NIH for this kind of work. So that's an initial response.
Sarah, do you have any thoughts? I also wanted to add some more things, but Sarah, I want to give you, Sarah, an opportunity to respond too.
Very quickly, I think by virtue of being in Baltimore and having Johns Hopkins in Baltimore, we benefit from that relationship highly. So I'll just turn it back to you. I think we are just mostly lucky in that we get to participate and benefit from these models that are based here.
Now, I do want to add that I've heard this in the past. People say, "Well, you guys have this extensive relationship. How does someone want to start off? Because you can't go back and quickly add 15, 17 years, and not everyone has a special person like Joel Gittelsohn or a special person like Sara, et cetera. I would urge, don't let that dissuade you from doing it. You can always start somewhere. And so you can take this at a micro level. You can start establishing relationships, and you can start small. You don't have to say, okay, let's build a large-scale agent-based model of the entire community right off the bat. As Joel indicated, you can start with smaller models. You can say, okay, let's look at this small, 1 mile radius or 2 mile radius, and let's just get a sense of what's going on. And that's when you can get everyone better integrated and help them understand, okay, this is what you're trying to do. Because many times when you say simulation modeling, people are not really sure what you're talking about. So if you can concretely show, okay, let's do a small example of what's going on, and then sort of ease into it. And then in terms of funding, yeah, that can be a challenge. Certainly, systems modeling is still a relatively new method in health and public health. But there are ways, especially if you want to do a smaller model. So a smaller model may not be as quote unquote expensive. So if you can convince folks, let's try to sink some initial resources. Maybe the local government has some initial quick resources where you can build a very small models just to show what's going on. And that eases people into it before you try to dive in and do the big thing.
We have kind of a related question, and this is for everyone as well. This is from someone who says they're non-technical, non-data kind of person who looks more at the programmatic side of things. And do you, in your opinion, think that public health data experts at a state level would be able to easily understand how to do something like you've been doing? And if so, would just reading a research article give them what they need to know? So it's, again, how do we go about this? How do we start? I think they're highly related.
Well, happy to start off, and then Joel and Sarah, feel free to chime in. there's probably significant variability, and we've seen significant variability at the state level in terms of their experience with this type of modeling. There are other arenas where, including pandemic response. So in the 2009 H1N1 pandemic, we interacted heavily with different federal, state, and local decision makers. And for instance, people in the state of Pennsylvania were quickly able to understand what we were trying to do when we built an agent-based model of the entire state of Pennsylvania. So, for instance, if you went to state level decision makers in Pennsylvania now and wanted to do some type of modeling besides pandemic modeling, there would probably be some experience or understanding of what you're talking about, et cetera. But that may vary from state to state. One of the challenges with sending a research article, it really depends on how technical it is and, how it really lays out what's going on. You want to make sure that the modeling can actually resonate with the decision makers. So if you start throwing around terms and things like that without helping them understand how can this actually help your decision making, it can actually work in reverse, because it can make modeling seem like something which is, highly scientific or more of an academic exercise. When in actuality, there are many examples of people in many different countries using models to make decisions. So I would suggest, if you're going to choose a research paper, choose one which really kind of adjusts bridging that gap. And also, you'll see in the popular press, there are more and more examples of articles covering the use of models. So you might want to look at those, because those tend to be written in more lay language, but also nothing beats talking and making presentations and discussing things with people. Sara, do you have any thoughts?
Well, maybe I'll just add to that really quickly.
Yep.
So I think the perception may be that we go from nothing to a complex simulation. And to be honest, I think there are many, many steps in between. This is a participatory process that we engage in, and there's substantial planning and things like group model building activities that can be done without a whole lot of statistical and mathematical calculation that can be done in the early stages, and that's actually very necessary for developing any kind of simulation model. So there's a process that is undertaken, and you move along the stages of the process. In the example of the Staple Foods Ordinance, the first thing wasn't suddenly we came up with this. We develop a mathematical model. The first thing was starting to talk about, well, what is it that we're trying to deal with? What are the concerns? What are the considerations? Well, what are the main actors or the players? Well, okay, let's say it's retailers. Well, what are the factors that influence retailers? So there's many lengthy discussions and initial boxes and arrows before we even set calculator to work in terms of coming up with simulation modeling. So I think that emphasizing this process which is something that everyone can be involved in, and many times group model building does not involve, is not exclusive to academics or researchers. It's regular community members are involved in certainly in that stage of the work. So I think, again, knowing that you start off from earlier, less complex sorts of things, and that's critical to the process, is important.
Sara?
Yeah, and I also think that this raises an important point that and as Joel alluded to, you shouldn't expect to go from like nothing to like perfect complex model that represents everything. It's actually an iterative process. And so you can start off with a simpler model. And the other question frequently get is, oh, well, doesn't the model require like all this data, and we don't have all this data and information? There is significant use in terms of developing an initial smaller conceptual model to help people understand, okay, this is how we picture everything fitting together. This is our conceptualization system. Even though it's not complete, even though it doesn't include everything, even though it may be lacking data, it gives you a sense like, okay, I understand. So, as the modeler, this is my understanding of the system. Joel sits there and says, oh, okay, yes, that makes sense from an intervention standpoint, community standpoint. Sarah says, okay, that makes sense from a policy standpoint. So we're all on the same page. And then we say, okay, but here's where we're missing information. We don't understand these things, this thing. Okay, let's go out and collect more data. Let's do a study. Let's talk to more people. So it can form the basis of framework on like how you do everything. So it's really, again, an iterative process.
Thank you. We have 2 minutes and we have time for one more quick question. And I think this is mostly directed at Sara. And the question is, were there training programs that assisted the small urban farmers to be successful, especially those who were just getting into this and starting this kind of work?
Sure. So the urban agriculture tax credit is just one small piece of how the city and many other partners look to support farmers. There's an organization called Future Harvest that has a beginner farmer training program where they pair a new farmer or someone who's interested in farming with an existing farm to learn directly from them. The Farm Alliance of Baltimore City is an excellent organization that comprises about 20 plus of our urban farms. It's a member organization. They work collectively to share tools and expertise, as well as advocate for policy change. And they are in the process of beginning a farm incubator, as well as an organization called the Black Church Food Security Network is also trying to do a lot of beginner farmer training through Black churches and networks. And I know we're out of time, so I'll leave it at that.
Well, I want to thank everyone in the audience for your thoughtful questions. I do want to comment that there were a lot of other questions that we weren't able to get to. So the audience has been really, really engaged in your terrific presentations. I really want to thank you for putting this together. We're going to take a 30-minute break now, and we will reconvene at 12:45, 30 minutes from now. So I guess it's time for a little quick lunch break. Thank you again to our speakers.
Thank you
For having us.
Thanks, everyone.